I am Dr. Matthew Opalach, and I am board certified in family medicine.
In this video, I will be discussing Ehlers-Danlos Syndrome. The main features associated with Ehlers-Danlos Syndrome include skin hyperextensibility, joint hypermobility, and tissue fragility. Currently, there are 13 major types of Ehlers-Danlos Syndrome. Hypermobility EDS is the most common, followed by classical EDS and then vascular EDS. EDS should be suspected as a diagnosis when a patient presents with some combination of the following features. These features include joint hypermobility, multiple joint dislocations, translucent skin, poor wound healing, easy bruising, hyperextensible skin, unusual scars, and dissection of a blood vessel. The features of hypermobility EDS include large and small joint hypermobility, spine hypermobility, joint dislocations, chronic joint pain, delayed gastric emptying, irritable bowel syndrome, and autonomic dysfunction. The inheritance pattern of hypermobility EDS appears to be autosomal dominant. This means that only one parent has to carry the mutation in order to pass it on to their child. Unfortunately, the underlying genetic abnormality is still unknown. The features of classical EDS include skin hyperextensibility, abnormal wound healing, frequent joint dislocations, osteoarthritis, scoliosis, fatigue, development of hernias, cervical insufficiency, and uterine prolapse. There are two types of classical EDS. In classical-like EDS1, there's a tenascin X deficiency resulting from a mutation in the TNXB gene. The inheritance is autosomal recessive, meaning both parents have to pass the gene on to the child in order for the child to express the disease. In classical-like EDS2, it is due to an autosomal recessive mutation in the AEBP1 gene. Vascular EDS is potentially life-threatening. It involves the risk of spontaneous vascular rupture, the risk of spontaneous organ rupture, and the risk of a potentially shortened lifespan. Vascular EDS can be due to a mutation in type 3 pro-collagen that is inherited in an autosomal dominant fashion. However, 50% of cases are due to new mutations.
Knowledge is power, especially when it comes to your health. If you value the medical information provided, give this video a thumbs up and subscribe for more informative content.